Corporate America is doubling down on vaccine mandates as companies like Walmart, Google, Tyson Foods, and United Airlines have begun enforcing vaccine mandates on their workers. In Florida yesterday, a judge ruled that Norwegian cruise lines can demand their passengers be vaccinated before boarding, dealing a major blow to Governor Ron DeSantis' effort to ban vaccine passports in the state.
Joe Rogan has been outspoken on the idea of vaccine passports, saying recently on his podcast that implementing such a system could bring the U.S., quote, one step closer to a dictatorship. Democratic strategist Jennifer Holdsworth-Karp and Senior Director of Policy at the Conservative Partnership Institute, Rachel Bovard, join us to discuss. Jennifer, let's start with a place maybe we all could maybe agree. Who's going on a cruise unvaccinated at this point?
Yeah, obviously I have some real questions of judgment of folks that would do that. But look, it's unfortunate. I think as a society, we have stopped putting information into the ether about the vaccine and instead have sort of gone to our corners in the political world, right? The left has said, if you don't get the vaccine, you're stupid and we hate you and you're ridiculous and you don't belong in a civilized society. And then the right is like, we don't care if we die, we're not getting the vaccine because you can't tell me what to do. And we have gotten to this place where the conversation around public health has gotten lost. You know, let me just set out and say that comments made like those by Joe Rogan are not helpful. It is a symptom of the decline of American political discourse, the Kardashianization of commentary, if you will, in terms of what we should be telling the public. You know, Joe Rogan has a very big platform where he could really spend the time informing. I understand that it's an entertainment program, but this is a really lost opportunity. Now, in terms of the vaccine being mandated by governments and by companies are fully free under the Constitution to institute these mandates. And I am shocked, I say, that there are Republicans in Florida and other places who want to now interfere with what businesses are doing in order to protect their customers. So I think that we need to return to a place where we are putting out information, where we are talking about public health as a collective goal, instead of a conversation about vaccines being tyranny. Clearly, George Washington would disagree. A number of other people throughout history would disagree. When I came back from studying abroad in law school, I had to present my vaccine passport. This is not a new concept, and I think it's actually towards the ridiculousness that people are disagreeing with it.
No, Jennifer, it's a very interesting take, and for what I'm certain will be a different one, I'd ask Rachel. Certainly, people like myself, and I think you agree, oppose vaccine mandates. But I have to ask, when we see rising hospitalizations in many states, and now we're seeing even children being affected by the virus, is there an in-between where we have some sort of requirements for people to be in the public square safely? Or is it that we should just say kind of a do as you see fit and hope for the best? What's your take?
Well, I think we are in the in-between in the sense that we have 3 widely available vaccines that are incredibly effective against death from this virus, which is, I just want to pause and say how incredibly fortunate we are to have that. And for everything to come together as it did within a year to get us to this point, I think we should be incredibly grateful for that. So at some point, the government at some point in this debate, the government's going to stop or has to stop being responsible for the sickness and death that it's provided the means to avoid. Everybody has access to these vaccines generally within 24 hours. Unfortunately, I think in some states where you are seeing rising cases, Andrew Sullivan had a great Substack about this recently. He said, hopefully that will actually convince people, right? That is actually the most effective way to compel people to get a vaccine, is to see it, tear through your community in some cases, which is really unfortunate, but it's much more effective than a CNN anchor telling people they're stupid. So, I think at some point human agency is important here. And I think with regard to the stats on children, so much of this debate, and I think one of the really frustrating parts, is that it's divorced from the wider context. Even when we're talking about rising cases, the death rate is so dramatically lowered from what it was in January, where we were seeing 3,000 deaths a day, where now the 7-day rolling average is close to 400. And pulled up a report this morning from the American Academy of Pediatrics where it says among states reporting children in hospitals, it was at 0.00 to 0.26% of all COVID-19 deaths, with 7 states reporting 0 child deaths at all. So we know children are dramatically at lower risk from this virus, and you'd hope that data like that is driving policymaking.
And the U.S. has set a new record for the number of children hospitalized with COVID. Most of these kids are younger than 12 and are not eligible to be vaccinated. This has prompted many teachers' unions to once again push for a vaccine requirement. In California, lawmakers and teachers' unions stopped short of a vaccine mandate. In Louisiana, to Rachel's point, medical officials there have said that while they are seeing an increasing number of children in the hospital, in one hospital that was where the head was interviewed, they had not seen one single child who had been fully vaccinated. And so that's the key distinction that Rachel's making here. I think that children, once you have the virus, ripping through the community, it is going to impact some number of children, even if most children are completely safe from it. But then those who are vaccinated wind up being almost entirely protected from hospitalization and death, if not entirely. Jennifer, do you think that's breaking through to people?
I don't, because there seems to be this fundamental disagreement between folks who believe that if you are vaccinated, that you are protected from death, but you still may actually get a breakthrough case, especially children under the age of 12, where the vaccine is not approved for them yet. Or is it acceptable to not get the vaccine, to actually get the virus, to focus on the natural immunization, which I need to point out does not last forever? There are no studies that actually report that your immunity to COVID, if you have gotten natural antibodies, lasts for longer than a certain period of time. So I think we need to be very clear about the debate that's happening here. There are some folks and some communities who feel that it is acceptable if children get COVID. They're probably not going to die from it. Obviously, as those statistics that you just quoted and that Rachel just quoted, we're seeing an increase in hospitalization, but we're not seeing an increase of death of children. Some communities right now, especially in Florida, are saying that that is acceptable, right? Then there's other communities who are taking every precaution possible not to have children infected, specifically because we don't know ultimately what the long-term effects of being infected by COVID are going to be. It is possible that 10, 20 years from now, we are going to see some rampant side effect from having been infected by COVID. So I think you have an overabundance of caution in some cities and communities, and you have this sort of laissez-faire, let what happen will happen attitude in other communities, and they're really bumping up against each other now. The government's role in all of this is to give as much information as possible and protect the larger amount of citizens, right? And that is ultimately their charge. And if a vaccine mandate is going to protect the most vulnerable, there are a number of folks who have autoimmune diseases who actually didn't know if they were going to be allowed to get the vaccine when it came out. Ultimately, a number of the autoimmune diseases were put on the list as allowable for the vaccine. But if we're going to say as a society, we're going to let this little bit perverted conversation about freedom affect the most vulnerable in our society, then I think our government is really failing at this conversation.
Well, and let me ask Rachel. The Biden administration has been obviously vocally pushing the vaccine. They've engaged, celebrities, influencers, young people to tout getting the virus. But what are they getting wrong for the tens of millions of Americans who are vaccine skeptics, who don't necessarily trust our institutions, certainly don't necessarily trust our government? What could they do better to instill a sense of confidence in the public that this is the best thing you could do, it's safe, it's effective? What more could the Biden administration do?
Well, I think the whole tone toward, even the fact what we call the population, we call it the unvaccinated, right? We've almost set up this segregated system, or the lords and the serfs, right? That's how we talk about this debate. And I think that level of condescension helps no one. And, I think the White House hasn't been necessarily the primary driver of it. I think, honestly, the cable mainstream news has, to be totally honest. But I think, actions where we saw, Jen Psaki being like, well, we are trying to work with Facebook to control what can be said. And, putting people like Dr. Fauci, even Francis Collins, out there saying, why is this so political? It's obviously political because of, the debate surrounding it. So they're not necessarily helping what's happening here. I think the point that Jen made is an interesting one, though, because when we're talking about communities having different standards here, that is America. That is our system. Our system is set up, as a federalist system for states to make their own decisions, for local communities to make their own decisions in many cases. And that's what you're seeing. And, for better or for worse, we can debate the merits, and we should, of how these policies are playing out. But that is indicative of, what Americans expect. We're never going to be Australia, where we're going to line up in the queue and submit to military inspection of our communities to enforce a quarantine. That's just not who we are. And so I do think that, these state by state decision making policies, that's sort of the best way we're going to muddle through this. Some states are going to get it right and some states are going to get it wrong. States are going to decide to handle this as they're going forward. And I would point out, you have an approach in Florida that's getting a lot of attention. It still hasn't touched the death rate that's in New York, right? Mm-hmm. So we're seeing policies, have different outcomes all over the country. And for better or for worse, that's kind of how we're set up to deal with it.
Well, Rachel, Jennifer, thank you so much for joining us.
Thanks, guys.
Thank you.
Coming up, The Intercept's Michael Lee discusses reporting about who actually funded the Tea Party Patriots when Rising returns.